In the heart of the Chandrabhaga, the Associated Hospital of Government Medical College, Doda continues to serve a vast landlocked population from the aging premises of the old district hospital building. Viewers, with only two elective operation theatres catering to multiple surgical specialties, general surgery, obstetrics and gynecology, ENT, and orthopedics, long waiting lists have become routine, while recent structural concerns, including damaged ceilings in critical area requiring temporary plywood reinforcements, highlighting the urgent strain on existing infrastructure. These challenges, amplified by the overcrowding since GMC Doda's inception, underscore the pressing need to expedite the long-pending new hospital complex, which promises enhanced critical care facilities and dedicated spaces for our postgraduate residents and staff, ultimately delivering timely, reliable healthcare closer to home for thousands in this remote region. Namaskar, my name is Amit and welcome to Speak Straight. Viewers, as we all know that healthcare infrastructure in Jammu and Kashmir has recently come into focus after several reports in the well-known English Daily Excelsior highlighted serious challenges in government hospitals across the Union Territory. Viewers, according to the newspaper's reports, several major hospitals in Jammu have faced problems such as non-functional MRI and CT scan machines and shortages of ventilators. These issues became serious enough to attract the attention of the High Court of Jammu and Kashmir and Ladakh, which took suo motu cognizance and directed authorities to ensure timely repairs, procurement of equipment and proper accountability through the Jammu and Kashmir Medical Supplies Corporation Limited. While these issues are being addressed at the UT level, similar concerns are also relevant for newer medical institutions such as Government Medical College Doda, which serves a large and a geographically difficult region. The Associated Hospital of GMC Doda continues to operate from the old district hospital building. Since the medical college started functioning, patient load has increased significantly. People from remote areas of Doda district and nearby mountainous regions depend heavily on this hospital for treatment. However, the existing infrastructure was not originally designed to handle such a large volume of patients. For example, only two elective operation theatres are currently available to serve multiple departments, including general surgery, obstetrics and gynecology, ENT and orthopedics. As a result, waiting time for routine surgeries have increased, causing inconvenience to patients and their families. Thus, doctors and hospital staff are doing their best with the available facilities, but the infrastructure is clearly under pressure. In some operation theatres, temporary measures have reportedly been used to maintain services due to damage in ceiling structures. While these steps allow medical services to continue, experts believe that structural strengthening and modern upgrades are necessary to maintain the highest standards of hygiene and patient safety. Another challenge is the limited availability of advanced surgical equipment. Modern surgical tools such as bipolar devices, harmonic, scalpel and thunderbeat, commonly used in advanced surgeries, are still in the waiting list. Similarly, machines required for blood component separation, which help provide plasma, platelets and other life-saving blood components, are not yet fully operational. Because of this, some patients still need to be referred to larger hospitals in Jammu or Srinagar for certain services. Absence of a fully equipped ICU with adequate ventilators also increases referral rates, especially in critical cases where timely care is extremely important. Viewers, there is however an important positive development also. The construction of the new associated hospital complex for GMC Doda has been underway for several years. Once completed, this facility is expected to significantly improve healthcare services by providing modern infrastructure, additional operation theatres, and better accommodation for doctors and our postgraduate residents. Viewers, many people in the region hope that speeding up the completion of this new hospital building will reduce pressure on the existing infrastructure and allow GMC Doda to fully realize its potential as a major healthcare center for the entire Chandrabhaga region. Viewers, healthcare experts often point out that strengthening public hospitals is a collective responsibility involving government agencies, administrators, policymakers, and medical professionals. Viewers, doctors and medical staff working in challenging regions like Doda frequently serve patients under difficult circumstances, and better infrastructure and equipment can greatly support their efforts. Viewers, the recent attention given to the healthcare infrastructure across the Union Territory of Jammu and Kashmir, and especially after media reports, the court observations offers an opportunity to address similar needs at GMC Doda as well. Timely upgrades in the infrastructure, availability of the modern equipment, and faster completion of the new hospital complex could make a significant difference for thousands of patients who depend on this hospital or on this institution. Viewers, strengthening GMC Doda is not only about improving one hospital. It is about ensuring that people living in the remote mountainous areas have reliable and accessible health care closer to their homes. Jai Hind, Jai Bharat, and Vande Mataram.